Bamboo nodule of vocal fold commonly associated with mixed connective tissue disorder, SLE, rheumatoid arthritis, and Sjogren syndrome. Answer of this question is mixed connective tissue disorder. This disorder is having more than two diseases, which is a initial stage of rheumatoid arthritis, SLE, Sjogren syndrome, dermatomyositis. So this mixed connective tissue disorder may have SLE, rheumatoid arthritis, Sjogren syndrome, dermatomyositis, polymyositis. So this is the disorder of combinations, more than two diseases. So answer of this question is mixed connective tissue disorder. Mixed connective tissue disease is a rare autoimmune disorder known as by presence of antibody anti-U1 ribonucleoprotein antibody. This include systemic lupus erythematosus, dermatomyositis, rheumatoid arthritis, Sjogren syndrome, polymyositis. So this disease is more than combination of two diseases. Bamboo nodules are round pale yellowish lesion found in the mid third of the membranous vocal fold, and these patients usually present with hoarseness of voice, breathy voice, and change in the voice. A blood test to exclude autoimmune disease is mandatory if patient is not already diagnosed for autoimmune disease. These nodules are unique, creamy, transverse submucosal bands on the surface of the middle third of vocal fold. Their appearance is just like a bamboo stick. So these nodules are called bamboo nodes. Frequent symptoms may be hoarseness, vocal fatigue, vocal breaks, unstable voice, dysphonia without dyspnea, voice abuse. These are the clinical symptoms. On endoscopy, there are submucosal transverse band on the middle third of the vocal cords, perpendicular to the middle edge of the free vocal cord, and they are mostly bilateral. You can see this picture. This vocal fold just seem like a bamboo sticks. So this is called as bamboo nodes on the larynx. In this disease, therefore, we have to rule out the autoimmune disorder. They are commonly found in the female, about 80% of cases, and less common in the males. They may be associated with smoking and alcohol, and commonly found in the female teachers who are associated with any autoimmune disease or thyroid disorder, mainly hypothyroidism. The pathophysiological mechanism of bamboo nodules formation remains unclear. There are mainly two hypotheses. Autoimmune lesion, since most bamboo nodules are associated with autoimmune disease, so there are chances of circulating immune complex deposition in the vocal folds. Another theory is microphonotrauma secondary to vocal abuse, as vocal nodule lesions are located in the mid portion of the vocal folds, and they are on the maximum aerodynamic and muscular forces. So there are these two common diseases associated with this. Most of the cases are associated with autoimmune disease, about 92% of the cases, and vocal abuse also having component about 70%. So these bamboo nodules most commonly associated with autoimmune disease. The first line treatment is correct the underlying autoimmune disease and underlying mechanical trauma factor by the speech therapy, systemic steroid therapy. In some cases, we required annual injection of steroid to prevent the atrophy of the vocal fold, and required sometime microphonosurgery to excise these nodules. So this is the treatment of bamboo nodules.